Namaste, Swamiji. This is regarding Namaste. He is Rajeshwar Rao. So he has undergone DBS surgery for
Ah,
Parkinson's, which he is suffering from almost 8 years now, and his age is 46 to 47. So 6 months back he has undergone DBS, but now he is seeing the problem with the gait. His movement, his walk, and all is disturbed. There's no control over his body when he's walking. There's a lot of problem that he's facing, and he's also facing issue with the pains, body pains, the joints, neck pain, shoulder pain, and kind of. So the DBS has not shown much improvement. So his concern is whether this Kumbhak will improve his situation in terms of his pain and gait problems.
see, I'll explain you DBS in a very different manner. Have you seen an earthworm?
Yes, yes.
Now, earthworm, if the earthworm dies, you just stimulate, give it a little current, it'll move for for a few seconds and then it'll again die. Now, DBS is like that. We are trying to revive earthworm, the life of earthworm, which is an impossibility. It is stimulation given to the brain, thinking that brain will be able to regain its regenerative ability. See, if the body doesn't have that kind of a strength, of a regenerative strength, by just giving an external stimulation, it doesn't work. If your legs become weak, by sitting on wheelchair, giving it some kind of support, your legs do not become strong. So, the strength is from inside. Everything your body is doing, the strength on which it is doing is from inside, not from outside. A child doesn't grow by an external stretching or support. It grows on its own. Plant doesn't grow by an external support. They grow on their own. So this strength of growth from inside is called as Kumbhaka. So unless and until your body has that kind of strength, by stimulating it from outside, there is always a risk of growth deviation in the body. For example, if there is a tissue mass inside the body and you cut it, do a biopsy, cut it open and try to test the tissues there, actually that can cause uncontrolled growth, which we know as cancer. The very intervention can cause undeviated or deviated growth, unstoppable growth. So whenever we stimulate this body from outside, if we stimulate this body from outside, there is always a chance that the growth factor will get deviated. But if we stimulate this body from inside, it is body's own growth factor which will never cause disease. Body is designed to fight disease, not get into disease. Since we are doing everything from outside, taking a pill, a medicine, some kind of stimulation from outside, this body always treats an outside stimulation as a risk, as some kind of danger. This is something that we need to get to. This is some sense that we need to get to. So, the body, this body's own growth factor or the growth making strength or metabolic strength or regenerative strength or detox strength is Kumbhak. If he does Kumbhak, at this point of time it has gone into his psychology also. So he'll have to do Kumbhak for a little long period of time. Take a 1 year target and see he'll come out of many